Chapter 25 is over immobility and associated issues along with immobility. Some terms that we refer to when we talk about immobility. We talked about these earlier in the semester. You have a handout that illustrates the different types of paralysis, or one of your picmonics. Hemiplegia is paralysis on one side of the body, so like right or left. Again, that's usually associated with a stroke. Paraplegia, which is paralysis of the lower half of the body, and quadriplegia, which is paralysis of the trunk and all four limbs. So quadriplegia and paraplegia are usually associated with a spinal cord injury of some sort. And diplegia, which I don't know if we've talked about that one yet, this is symmetrical paralysis in any area of the body, like both legs or both arms. That one is much less common. In healthcare, we say if you don't use it, you lose it a lot, and it's very true. Inactive muscles lose strength, endurance, and mass very quickly. We call this muscle atrophy, which is basically when the muscles waste away. This can happen with bed rest. After a few weeks, half the body's muscle strength is lost. It can also happen to a part of the body that isn't used, like if it's in a cast for a period of time. Proper positioning of the immobilized muscles and joints is important because we don't want them to stretch or shorten. We see people with contractures, and that's from inappropriate positioning, putting pressure on the joints and muscles. These are irreversible. It can be something as simple as a tight blanket that puts pressure on the feet, causing the feet to drop. Bone also deteriorates without activity. So remember, osteoblasts are those bone building cells, and osteoclasts reabsorb bone. The tendons and ligaments are also affected. They require movement to maintain their structure and functionality too, and after a few days of immobility, they shorten and the flexibility and range of motion are affected. The skin is also affected by immobility. It breaks down easily when circulation is impaired. We start to worry about decubitus ulcers or bed sores because the skin is stretched over bony areas where there's not much fat or muscle tissue for cushion. Other factors that lead to skin breakdown are bad circulation or anemia or edema or inadequate subcutaneous tissue in older adults or disabled people, a loss of sensation, a mechanical irritation or friction. This is like if there's something as simple as wrinkles in the sheets. I've seen the ties on hospital gowns cause bed sore, and the IV tubing cause blisters and skin breakdown. Excessive moisture from sweating or urine, poor hygiene, poor nutrition or hydration, and trauma to the skin. Initially, when someone is fully immobilized and they're laying in a bed, more blood returns to the heart from the legs, so it starts to pool in the trunk area, increasing the heart rate and stroke volume. With prolonged immobility, venous return and cardiac output are reduced, and the patient can get orthostatic hypotension when they change positions. So they might have dizziness, fainting, pallor, and sweating with a rapid pulse. After someone has been immobile for a long time, it can take weeks for everything to go back to normal cardiac-wise. So when the blood pools, we call this stasis. There's an increase in capillary pressure and edema in the dependent areas of the body, like the legs if someone's sitting like in a wheelchair, or the coccyx if someone is laying in bed. With blood pooling, what do we worry about? Thrombus or blood clot formation in the veins, especially those deep leg veins. In patients with cancer or dehydration, there's an increase in the coagulability of the blood, so the chances of blood clots is even more likely. Virchow's triad is venous stasis, hypercoagulability, and blood vessel damage, and increases the chance of DVTs or deep vein thromboses. And of course, with blood clots, we worry about them breaking off and leading to a pulmonary embolism or a stroke or a heart attack. Again, the blood pools, we call that stasis. The thrombi can break away with movement or massage. This is why we don't massage an area that's like red, hot, swollen, especially in the calf, leading to a pulmonary embolus. Again, that can also go to the brain and cause a stroke, or the heart and cause a heart attack. Venous stasis, hypercoagulability, and blood vessel damage increase the chance of that deep vein thrombosis, or Virchow's triad. When someone's immobile, there's less demand for oxygen because the metabolism is decreased, so the respirations become slow and shallow. And if the body gets used to this, and as the muscles get weaker, deep breathing and coughing become more difficult. Also, if patients are taking drugs to help them sleep or to control pain, they depress the neuromuscular activity, causing slow, shallow breathing. When someone's immobile, secretions build up in the airways and they're hard to get rid of because coughing becomes difficult. This can lead to pneumonia and atelectasis. When someone's immobile, we worry about constipation. Also, when people are immobile, they typically have a reduced appetite, so they don't take in enough food, including fiber and fluids. Inadequate dietary intake can lead to a negative nitrogen balance, which is a protein deficit, which affects muscle breakdown. Sometimes prolonged immobility can lead to obesity because when someone is inactive, the calories they take in can very easily exceed the energy that the body needs. We also worry about urine just sitting in the kidneys or bladder because the normal drainage by gravity is affected when someone is in bed. This can lead to infection and kidney stones. In immobile people, we sometimes use catheters to help empty their bladders, and this can also cause infections. And when people are immobile and become edematous, we use diuretics to help reduce the edema, but that can lead to dehydration. Prolonged pressure on the skin and tissues can result in tissue damage that activates pain receptors and other receptors, leading to serious tissue damage, destroying the nerves over time. Spasms can happen from the nerve and muscle damage, and the effects of pain and lack of control over the person's environment can lead to depression, anxiety, confusion, and forgetfulness. When kids are immobilized for an extended period of time, normal growth can be delayed because the physical movement to stimulate bone and muscle development just is not happening. Deformities can develop in the hips, the hips, the spine, the hands, and the feet. So remember I told you about the little girl in the wheelchair. She was immobile in a bed for so long that her muscles were wasting away, and then we put her in a wheelchair. She had trouble holding herself upright, so she slouched to one side, and it made her spine horribly curved. She gave herself scoliosis. All right, and that's all we have for the effects of immobility. Chapter 25 is pretty short but sweet, right?